Assalamu alaikum rahamathullahi wa barkathahu. Welcome back, guys. This is Afros at Afros Nursing. So, today's topic is biomedical waste management, and I am going to discuss 25 most important MCQs on this topic. It is an example topic. Before going to start other classes, I am going to take a small and easy topic to make you understand very easily and very effectively. So without wasting time, let's get into the topic. So here biomedical waste management is nothing. The whatever waste is there, it should be divided into different type of categories in the hospital waste should be divided into different categories. And the color coded bins have been given in the hospital sector or health facility, okay, based on the type of waste uh, to be thrown in which color type of bin, okay. Here is a brief description. In India, all over India, there are most probably four colors have been used: red, yellow, blue, black, or white. Either black or white bins should be used in India only. Okay, in red bin, all plastic waste such as syringes, bottles, uh, plastic content, everything like urinary bags, IV sets, like that, everything will go into the red bin. And in yellow bin, only infectious waste like a bandage, cotton, and human anatomical waste like placenta, any body organs, etc. In blue bin, only glass bottles like discarded medicines, and all these things will go into the blue bin. Okay, ampoules and other things will go into the blue bin. Okay, in a black bin or white bin, black or white. In so many hospitals, there are white bins will be available. Uh, in some hospitals, there will be black bin. Okay, here if see in the options first whether they have mentioned both, then you will go for white bin. Okay, if they mention only white in the options, okay, go for white. If they mention only black, then go for black. Otherwise, the main protocol is white bin. So here all needles are sharp instruments without syringes. Needles without syringes. Here mentioning without syringes. The syringes will go into the red bin. Okay. Metal articles and sharp instruments will go into the white bin or black bin. Okay. Let's go into the MCQs. The first question is, what is the primary objective of biomedical waste management? Option A, to reduce healthcare cost. Option B, to minimize environmental pollution. Option C, to maximize waste production. Option D, to increase disease transmission. What is the primary objective of biomedical waste management? Primary objective of biomedical waste management: to reduce healthcare cost, to minimize environmental pollution, to maximize waste production, to increase disease transmission. Okay, increase disease transmission, it is wrong. To maximize waste production, it is wrong. To reduce healthcare cost, it doesn't relevant to the to this biomedical management. So the answer is to minimize environmental pollution. To reduce the environmental pollution, biomedical waste management is used. The second question is, which of the following is not considered as biomedical waste? Which of the following is not considered as biomedical waste? The first one is option A is used needles. No. Option B, blood soaked bandages. Yes, it is a biomedical waste management. Option C, plastic water bottles. Option D, discarded surgical gauze. So here user needles or the biomedical waste, blood soaked bandages or the biomedical waste, discarded surgical gloves, these are also the biomedical waste. So plastic water bottles are not the biomedical waste. Okay, see here question, see the question carefully, it is not considered as a biomedical waste. So that's why answer is option C, plastic water bottles. Okay, the third question, which among the following products are non-degradable? Non-degradable, biodegradable, sorry here, non biodegradable. Which among the following products are non biodegradable? Here mention is as a biodegradable. Okay, here option A is polythene bags, option B food waste, option C paper, option D dead animals. So food waste is a degradable, uh, uh, paper is a degradable, Dead animals are also degradable, but polythene bags are not degradable in the soil. Okay, that's why it is mentioned as a non-biodegradable products. Okay, which is the recommended method for disposal of sharp objects like needles and scalpels? It is very easy. What is the recommended method for disinfectant of sharp objects like needles and scalpels? Before going to discard these sharp and needles, so what we have to do? Autoclaving. Okay, before going to dispose these sharp objects like needles and scalpels, do autoclaving. Which regulatory body sets guidelines for biomedical waste management in many countries? Which regulatory body sets guidelines for biomedical waste management in many countries? Option A is World Health Organization, option B United Nations, option C Environmental Protection Agency, option D Food and Drug Administration. Answer it carefully. So if you do like to encourage me, it's my first starting videos. To encourage me to do better videos, please do like, share, comment and subscribe my channel. Okay, don't forget to hit the bell icon. So answer is World Health Organization, the regulatory body which guidelines sets guidelines for biomedical waste management in many countries are World Health Organization. Next question, what is the purpose of segregating biomedical waste at the source? What is the purpose of segregating biomedical waste at the source? To increase waste production, to facilitate recycling, to minimize the risk of infection, to expedite waste disposal. To increase waste production, to facilitate recycling, to minimize the risk of infection, to expedite waste disposal. So answer is to minimize the risk of infection. The purpose of segregating biomedical waste is known as to minimize the risk of infection. Then next question, which method is commonly used for treating biomedical waste before final disposal? Before final disposal, which method is used for treating biomedical waste? Landfilling, composting, direct dumping, chemical disinfection. Landfilling, composting, chemical disinfection, direct dumping. So answer is chemical disinfection. Which of the following color bag is used to discard resurrection of gangrene part of the patient? Here it is a gangrene part of the patient is a human anatomical waste. In which color bin it will go? Option A red, option B yellow, option C blue, option D black. The answer is option B yellow. Which of the following color bag is used to discard resurrection of gangrene part of the patient? That is yellow. What is the recommended frequency for training of healthcare workers on biomedical waste management? What is the recommended frequency of training healthcare workers on biomedical waste management? Option A once a year, option B once every 2 years, option C once every 3 years, option D training is not necessary. The answer is once a year. The recommended frequency of training healthcare workers on biomedical waste management. Next question, which document provides guidelines for the classification and management of the biomedical waste? Which document provides guidelines for the classification and management of the biomedical waste? Option A Biomedical Waste Act, Environmental Protection Act, Biomedical Waste Management Rules, Occupational Safety and Health Act. Here it has mentioned a document, so that's why these are all acts like a act, Biomedical Waste Act, Environmental Protection Act, Occupational Safety and Health Act, but it is a document, that's why it will come under Biomedical Waste Management Rules. Okay, remember that answer is Biomedical Waste Management Rule. Next question, which of the following is an example of the pathological waste? Option A used syringes, option B discarded gloves, option C amputated limbs, option D empty IV bags. Pathological waste, that means human anatomical waste. It is known as, answer is amputated limbs. So don't forget to share this topic. It may be useful for other aspirants. Please do share this content. So amputated legs are the pathological waste. Next question. What is the primary purpose of labeling biomedical waste containers? To make them visually appealing? No. To indicate the contents and potentially hazards? Okay. Option C, to increase recycling rates. Option D, to confuse waste handlers. So recycling rates is wrong. To confuse waste handlers are wrong. So the right answer is to indicate the contents and potential hazards, to identify it very easily. Okay. Used a nasogastric tube has to be discarded in. Used a nasogastric tube has to be discarded in. Option A red, option B yellow, option C blue, option D white. The answer is right, because nasogastric tube is a plastic waste, that's why it will go into the red color bin. Which among the following products are non-biodegradable? Which among the following products are non-biodegradable? It has been mentioned, this question has been mentioned before itself. Okay, the answer is polythene bags. Which of the following is not a recommended method for the disposal of liquid biomedical waste? Which of the following is not a recommended method for the disposal of liquid biomedical waste? Answer A, pouring down the sink with ample water, disposing in a designated liquid waste treatment system, absorption with appropriate material, followed by disposal as a solid waste. D, directly discarding into the regular trash bin. So option D is the right answer, because here it has mentioned not. Pouring down the sink with the ample water is okay. Disposing in a designated liquid waste treatment system, okay. It is the right method. Okay. Absorption with appropriate material followed by disposal as a solid waste, yes, it is true. But directly discarding into the regular trash bins are not a recommended method for the disposal of the liquid biomedical waste. 16th question. Which color code bin is typically used for disposing of cytotoxic waste? I have said previously, cytotoxic waste will go into, yes, blue bin. Okay, the answer is blue. If otherwise, if they have asked white and black bin, then it will go into the black bin. Okay, in international level, black bin is used for the cytotoxic waste. So answer is blue bin is the cytotoxic waste. Which organization plays a key role in regulating biomedical waste management in India? Option A, Ministry of Health and Family Welfare. Option B, Ministry of Environment, Forest and Climate Change. Option C, Indian Council of Medical Research. Option D, National Institute of Occupational Health. So, which organization plays a key role in regulating biomedical waste management in India? That is option B, Ministry of Environment, Forest and Climate Change. Okay. Next, which of the following is not a component of an effective biomedical waste management plan? Option A, segregation. Option B, collection. Option C, reuse. Option D, disposal. Which of the following is not a component of an effective biomedical waste management plan? Is reuse. Reuse is not a component of effective biomedical waste management. So segregation is done, collection is done, disposal is done, but reuse is mostly not done. Sharp blades and needles should be discarded in which of the following? Sharp blades and needles should be discarded in which of the following? Here I have mentioned black, white, red and yellow. I said before itself, if they asked black and white both, then you have to go for white, because internationally white is used for the sharp blades and needles. Okay, answer is white. Which type of biomedical waste possesses a risk of chemical contamination? Which type of biomedical waste possesses a risk of chemical contamination? Obviously, option A, pathological waste. Option B, infectious waste. Option C, pharmaceutical waste. Option D, sharps. The answer is pharmaceutical waste. Chemical contamination means pharmaceutical waste only. Next question. What is the primary reason for using color coded bins in biomedical waste management? Option A, to enhance aesthetic appeal. No. To facilitate easy identification. Maybe. Option C, to discourage waste segregation. No. Option D, to confuse waste handlers. No. Then answer is to facilitate easy identification. Next question. Which method is commonly used for the treatment of microbiological waste? Option A, incineration. B, autoclaving. C, shredding. D, landfilling. Obviously, microbiological waste is always autoclaving. So which method is commonly used for the treatment of microbiological waste is autoclaving. As per BMW, biomedical waste management, and according to WHO, infected syringes without needle is discarded into which color coded bags? Infected syringes without needles, yellow, red, black, blue. And then answer is obviously red, because all plastic waste will go into the red color. Next, 24th question. Which document provides guidelines for the transportation of biomedical waste? Document, here also I mentioned a document provides guidelines for the transportation of biomedical waste. Option A, biomedical waste management rules, International Air Transport Association regulations, so it is wrong. Occupational Safety and Health Administration guidelines, no. United Nations Framework Convention on Climate Change, UNFCCC, so it is also no. The answer is biomedical waste management rule. Last question. Which type of biomedical waste requires a double container for safe handling? Which biomedical waste requires double containment? Okay, double cover or double containment should be required for which of the waste? Option A, shops; B, infectious waste; radioactive waste; pathological waste. The answer is shops. Is sharp instrument should have double cover or double containment or double bag to discard the biomedical waste. Okay. I hope you all guys enjoyed about this. All these 25 most important MCQs. It has taken me a long time to search and to frame these question and answers. So please do like, share, subscribe, and comment below. If there are any mistakes or any suggestions, please do suggest me in the comments. I will rectify in upcoming videos. And please wait eagerly. Next upcoming videos are going to be rock. For each and every topic, I'm going to give 25 most important MCQs and a brief description about the topic. Thanks for watching. Thank you so much. Please do like, share, comment, and subscribe to Afros Nursing. Signing off.